Remember back in grade school when the teacher asked a question, every hand in the room shot up to answer. A simple, reflexive act involving the most complex system of bone and muscle in the body, the shoulder. But as we age, the shoulder can wear out, become arthritic, cause pain, even freeze up. For some, the last stop in treatment options might be a procedure called shoulder arthroplasty.
We don't often think about how much we use our shoulders until there's a problem with them.
I can't brush my hair, I can't hold a hairdryer, I can't button anything, I can't take my coat off myself, I can't pull my pants up myself, because this hand really is basically non-functional.
As shoulders get stiff, they typically hurt more. So as they begin to notice their decrease in function, they also begin to notice more pain.
They ended up backing away from squash. It became too challenging to be able to stroke the ball correctly, and it wasn't any fun.
And what they've noticed over time is that as their shoulder has become stiffer and stiffer and stiffer, it has become more and more painful.
Arthroplasty means it's literally change of the joint. And the common term that we use today is joint replacement. And what that involves is removal of the damaged joint and replacing it with artificial material.
I was terrified that, someone's going to come in and take my whole shoulder off, and, I was never going to be able to move my arm again.
I'm Dr. Scott McFarland. Join us as we explore the intricate workings of the shoulder and how doctors may be able to relieve chronic shoulder pain with shoulder arthroplasty. That's all coming up on Healthy Body, Healthy Mind.
Major funding for Healthy Body, Healthy Mind is provided by Baxter and by Celgene, committed to improving the lives of patients worldwide, and by Mallinckrodt Pharmaceuticals, dedicated to providing safe and effective medications and committed to helping ensure their appropriate use for a healthier world. Additional funding provided by DePuy Synthes Joint Reconstruction and by the University of Michigan Comprehensive Cancer Center.
Imagine not being able to reach up into a cupboard, swing a golf club, or reach out and shake a hand. All simple movements we take for granted because of our shoulder. The shoulder is a miraculous mechanism of muscles, tendons, and bones. As we age, this mechanism can wear out, become arthritic, or suffer an injury. It's then that we realize just how important a normally functioning shoulder can be. Without our shoulders operating properly, painlessly, with a complete range of motion, we couldn't do simple things like wave, point, reach, shake hands, sleep comfortably, or even hug. Think for a moment of what separates us from many other primates, the opposable thumb that allows our fingers to grasp objects. Believe it or not, without the shoulder, the thumb wouldn't be able to do very much. You could say a working shoulder is a thumb's best friend.
The shoulder is what helps people position the hand in space. The opposable thumb is what really separates us from our ancestors.
Dr. Gerald Williams is chief of the Division of Shoulder and Elbow Surgery at Rothman Institute in Philadelphia. He's also a professor of orthopedic surgery at the Thomas Jefferson University Hospital.
It has the largest range of motion in the body, and it acts like a ball and socket joint and allows us to put our hand anywhere in space that we would like it to, so that we can use our opposable thumb. And to get your hand in a position to use your opposable thumb, the shoulder is the most important joint. It allows you to position your hand in space so that you can use your hand.
The hand is the most important functional element in the body.
Dr. Peter McCann is chairman of orthopedic surgery, Mount Sinai Beth Israel Hospital in New York City.
What the shoulder does is raise the hand to get the glass off the top shelf. It'll position the hand out to put on your coat. It'll position the hand behind you to tuck a shirt in and to do activities behind you. So the most important function of the shoulder is to get the hand where you need to put the hand. We look at the shoulder, the four parts, as the four joints. So you start in the middle of the body at the breastbone. The collarbone articulates here, that's one of the joints. The collarbone comes out to the shoulder and articulates with the shoulder blade, that's a second joint. The most important joint is where the ball and socket meet, out on the side of the shoulder, and the fourth part of the shoulder is where the shoulder blade meets the chest wall. So those are the major four parts, but by far the most important is the ball and socket articulation. This is a model of a right shoulder looking from the front. Just to orient you, here's the collarbone in the front. There's the arm where we move up and down. And this is the shoulder blade that sits on the chest wall, and the shoulder blade moves on the chest wall. So the four parts of the shoulder are where the collarbone meets the breastbone.
If we think about the shoulder from the inside out, initially we have the bones, which we think about the ball and socket joint, which are bony structures.
Dr. Serena Namdari is a shoulder and elbow surgeon at the Rothman Institute in Philadelphia and an assistant professor of orthopedic surgery with Dr. Williams.
The next layer that we talk about is the lining of the shoulder joint, which is the capsule or the ligaments which hold the shoulder and keep it stable. Then we talk about the rotator cuff tendons, which there are 4 of, and they're very important to keeping the shoulder stable as well as helping to generate movement and function. And then finally we talk about the larger muscle groups that attach to the shoulder girdle, the deltoid muscle, the pectoralis, the latissimus. These are large muscle groups that initiate and maintain strength. Usually it involves reaching, lifting, or pulling. Oftentimes they have difficulty with overhead activities that involve any kind of weight. But most typically patients complain of difficulty sleeping at night.
Often, the source of this pain is the rotator cuff.
In order for the rotator cuff to act like a ball and socket joint, it's really important for the rotator cuff muscles to pull the ball into the socket. It acts like a ball and socket, but it's really more like a basketball on a teacup saucer. It really could slide all over the place, and the reason that it doesn't is because a normal rotator cuff pulls the ball into the socket or the basketball onto the teacup saucer so that when it rotates, it doesn't slide. And that requires a tremendous amount of repetitive force from the rotator cuff, even for daily activities. You can imagine how much it might need for things such as throwing a baseball or other very difficult activities, playing squash, etc.
Meet Bruce Wilson, a health club manager from Dorothy, New Jersey, about 25 miles west of Atlantic City. A lifelong athlete, Bruce loved playing basketball and has a passion for the game of squash. 8 years ago, he had his shoulder arthroscopically treated for arthritis, but last year, he simply couldn't tolerate the pain any longer.
Pretty much range of motion was my greatest challenge. My range of motion became less and less. It was one thing and then another thing and another thing, and I kept sacrificing things that I like to do for my range of motion.
69-year-old Carol Moss from Broomall, Pennsylvania, near Philadelphia, is a retired educator with 14 grandchildren and a passion for golf.
I had a fall, and after that, my shoulder was killing me. And I went to Dr. Williams, and he said it needs to be replaced, not repaired. It's just a mess. I mean, I can feel it grinding. He can hear it grinding.
We've been treating her for a reasonably long period of time, trying to get her better without an operation. And she finally figured out that it just wasn't going to get better, which is why we're here today. Her big thing is she wants to get back to golf.
Emery Todd from Bertrandville, Pennsylvania, is the founder of an accounting firm and spends a lot of his time behind a computer.
I started feeling a fair amount of pain in both my shoulders, lack of mobility, lack of flexibility, lack of strength. So I started going to my orthopedic surgeon, and he did some x-rays, and he said, "You're losing the cartilage in both your shoulders."
He was having trouble sleeping at night, couldn't put his shirt on because it hurt so much, had to take anti-inflammatories on a regular basis. It was just really interfering with his day-to-day life.
Already had Dr. Williams fix my right shoulder, but my left shoulder is coming up next, and actually going in next week to have that shoulder done. So I'll show you how far I can lift it up. Pushing, that's as high as I can lift it. Now here's the shoulder that Dr. Williams did 6 months ago. So there's a little bit of difference.
Our three patients, Bruce, Carol, and Emery, represent the most common causes of shoulder malfunction leading to the surgery known as arthroplasty. Age, genetic predisposition, including arthritis, traumatic injury, or repetitive motion.
Well, there's no typical shoulder patient. It really is a function of age. The 20-year-old who comes into the office complaining about shoulder pain will typically have soft tissue injuries, typically injuries to the ligaments, looseness of the shoulder, instability or dislocations of the shoulder. The middle-aged, and I'm calling middle-aged from the 40 to 60-year-old age group, they will complain of pain, but the cause of their pain most commonly is injury to the tendon, the rotator cuff. Over the age of 60, one has to think about arthritis of the shoulder as a cause of pain for those patients who present with shoulder pain.
The truth of the matter is that the older patients get, the more likely they are to sustain a rotator cuff tear without any trauma at all.
We believe there's a family predisposition to certain types of arthritis in the shoulder, and that's probably true in other joints.
We don't have great answers right now as to what the genetic variables are that contribute to that pathology.
We have some genetic family issues with our shoulders, and then over the years a lot of racket sports, racquetball, and kind of banging around bruised my shoulder up, and that started to cause the arthritis.
Oftentimes patients who are manual laborers will use their shoulders with more intensity, and then athletes, in particular throwers, use their shoulders with perhaps the most aggressive activities.
With a lack of mobility and often excruciating shoulder pain, it was time for our patients to do something about it.
I'll have the nurse call you when we get started.
Shoulder damage and pain comes in many forms and must be properly diagnosed for effective treatment. In most cases, the overriding consideration seems to be the pain involved and the extent to which the patient can tolerate that pain.
It's your left shoulder that's bothering you today. So let's start out with the good shoulder. Can you raise the right arm overhead?
First thing we do is take a good medical history. And the history involves questions such as, when does your shoulder bother you? Where does the pain start? Where does it radiate? What's the nature of the pain? Do you have any numbness, tingling, or other associated symptoms? And then we do a very targeted physical examination that involves evaluating a patient's motion and their strength that give us an idea of what we're dealing with, whether it's a rotator cuff problem or a labral problem or a problem with arthritis. Then we obtain radiographs and plain x-rays, and if those aren't sufficient, then we obtain further imaging like an MRI or a CAT scan.
We actually try to use non-operative management as much as we possibly can. So if it's really a matter of pain relief, we try things like non-steroidal anti-inflammatories. You can try injections of anti-inflammatories into the joint. That would be a cortisone shot. If their shoulder is somewhat stiff, one of the strategies is to try to stretch out the joint to get back some of their motion.
When those fail and patients continue to have persistent symptoms, then we entertain surgical treatment.
Arthroplasty is basically reconstructing an arthritic shoulder. Anytime that you have any joint in the body that's arthritic and painful, you really only have three choices to manage it. One option is to actually cut the joint out and create a gap between the two bones so they can't hit each other anymore. A second choice is to take the two bones and fuse them together so that they don't move anymore. The third choice is to reconstruct or resurface the joint with prosthetic parts, and that's what arthroplasty is.
This is the choice that both accountant Emery Todd and squash player Bruce Wilson made. But not all patients choose surgery, nor should they.
First and foremost, it hurts. Shoulder surgery is not painless. It can sometimes involve a recovery that is lengthy, patients' work, and other demands that prohibit surgery. And then it involves a general anesthetic often, and so there's risk that's inherent to any type of surgical procedure. Anytime we make an incision in the skin, no matter how small, there's always a small risk of an infection or bleeding, damage to nerves or blood vessels, poor wound healing, or other complications.
You'll have an incision that goes just about like that. It'll be about that long and in that position. Okay.
With Carol Moss, who considers herself a bionic woman, after having both her hips and a knee replaced, and who was anxious to get back to her golf game, the choice for arthroplasty became obvious.
When she finally figured out that non-operative management wasn't going to work, then we started talking about surgical options. So your rotator cuff, we believe, is intact on the basis of your MRI scan. We do think that you're missing a fair amount of bone on the socket. So we have in the operating room both a regular socket and a socket that requires less bone removal. And we'll use whatever one we think we can get in easiest and best.
I'm really not afraid because my other replacements were so pain-free. I have no pain in my knee anymore. I have no pain in my hips. I thought the therapy was easy. And I just couldn't be happier with my new parts. So I'm looking forward to my fourth new part.
Sometimes people's range of motion is restricted because there are so many bone spurs and osteophytes on the humerus that it's just flat now.
For a shoulder replacement, what we do is replace the arthritic ball with a metal ball. And the arm bone is really a tube, so the metal ball is attached to a stem that we put down into the tube of the bone to hold it there. But the only thing that the shoulder sees is the metal ball here. And on the shoulder blade side, we put a plastic piece with some prongs on it, and we make holes in the socket and we put the plastic piece in there. So this is what a shoulder arthroplasty is. We're changing the joint, we're replacing it with a metal ball, and it articulates with a plastic socket, and that's what it looks like. And here's where the arm moves after the operation.
So the steps would be to get down to the joint. We then reflect the subscapularis, which was the tendon in the front of the shoulder, and we usually take it with a little fleck of bone. We reflect that out of the way. We then resurface the joint with metal on one side, plastic on the other, and then we put it back together. I think there's a reasonably good chance that if Carol's rotator cuff stays intact and doesn't get degenerated and develop a tear, it'll probably last her lifetime.
As we're about to see, arthroplasty has led to success stories with patients Emery Todd and Carol Moss. What can they look forward to down the road in terms of recovery and return to activity? And we'll let Bruce tell you what he's been up to lately after his surgery. Coming up, we'll join Carol in the recovery room with her physical therapist, and we'll see what the future has in store for shoulder arthroplasty patients in the years to come. Currently, there are more than 100,000 shoulder replacements per year in this country versus 900,000 hip and knee replacements. After 10 years, 90% of shoulder replacements are still working. If you'd like to see this program again or watch any of our other Healthy Body, Healthy Mind programs, please visit our website at hbhm.tv. For our patients, shoulder arthroplasty, followed by a carefully prescribed course of physical therapy, has enabled them to return to the activities they love.
So I wanted to get back and do that, have some muscle tone, you know, on the whole body, and I worked on that gradually. I got my shoulder around Christmas time, and within a 6-month period, I was back on the squash court, hitting the squash ball again, taking my time, working my way into. I was hitting golf balls, you know, and it had a real nice function of life. This was like a day at the beach, recovery-wise and function-wise.
When I saw him back on his first post-operative visit, his range of motion was just about normal. He was doing his exercises like a machine.
I got zero pain. You know, I mean, things that I do, I have zero pain, zero discomfort. And what limitations do I have? I don't have any limitations. There's nothing that I can't do.
In Bruce's case and Emery's case, their rotator cuff was really just about normal. So their cuff for the foreseeable future will probably remain intact, and I don't see any reason why their shoulders won't last 15 to 20 years of reasonably good function.
So the whole recovery thing was just really good. I mean, they had a physical therapy person came in the next day, started me doing exercises right away because they want you to start loosening up and strengthening like right away.
Motion recovery generally can take anywhere from 3 to 4 months. The strengthening process is longer, so patients may feel like they don't have their strength back for up to a year or longer after the surgery.
Within hours of surgery, Carol was meeting with her physical therapist, Kim Yastremski.
Let's try again. We're going to straighten. So there's our sideways palms. The power of the left is lifting. You will typically feel a pull. It feels like a tape pull in your armpit.
Yes.
Yep. So everybody describes it like that, and that's generally because the block doesn't get there well.
She'll be really good by 6 weeks. She'll be very happy with it, doing most of her daily activities. She'll be playing golf at around 4 months. By 6 months, she'll be great. At a year, she'll be really good. And that's true of all three of them, quite frankly.
The short-term expectation is to return to an active lifestyle. I have many patients who play tennis with a shoulder replacement, golf, they swim, they work out in the gym, they essentially have normal activities.
And what can future patients look forward to with shoulder arthroplasty?
We're hopeful that we'll find ways to prevent arthritis and to help try to treat arthritis when it does occur without performing an arthroplasty. Much of the research that's currently in place, especially as it pertains to arthroplasty, is to try to develop implants and designs that will last longer and to more accurately recreate the anatomy.
There is some research going on that would be a pharmacological way to try to either prevent or at least delay the development of arthritis.
Like all mechanical devices, artificial shoulders can wear out. The younger the patient, the greater the likelihood that they will have to have another artificial shoulder in the future.
Currently, we tell patients that their total shoulder arthroplasty will last somewhere around 15 and maybe 20 years, depending on how they use it. Much of the interest and much of the research that's currently in place, especially as it pertains to arthroplasty, is to try to develop implants and designs that will last longer and to more accurately recreate the anatomy and to allow surgeons to place those implants in an appropriate and a reproducible manner.
I think what the holy grail will be considered in shoulder arthroplasty is to develop a socket that would last the lifetime of anybody who needed it. In my opinion, we're not even close to that just yet, but that's what we all dream about and that's what we all work toward.
With a new shoulder comes a return to the enjoyable activities of an earlier time, more flexibility and often pain-free activities.
It's been a really, really good experience. I mean, it really has. I mean, I can't, you know, if you know, nobody wants to do it, but if you got to do it, I mean, it's way, way better than I ever expected.
I mean, squash is truly a pleasure of mine that I love to do. This was just an additive to that, it was icing on the cake.
I expect to be able to do everything normally, which is a miracle.
As we've seen, shoulder arthroplasty may not be the solution for every case of arthritic shoulder or rotator cuff damage. But for more than 100,000 patients a year in this country, it can mean the return to those lifestyle activities we love, a reduction in a life of pain, and the ability to make a simple, friendly gesture. That's it for this edition of Healthy Body, Healthy Mind. I'm Dr. Scott McFarland. See you next time. If you'd like to see this program again or watch any of our other Healthy Body, Healthy Mind programs, please visit our website at hbhm.tv. To answer any specific questions you may have, be sure to contact your healthcare provider. To comment on today's program, please call 380-6500 or email hbhm@itvISUS.com or visit our website at hbhm.tv.
Major funding for Healthy Body, Healthy Mind is provided by Baxter and by Celgene, committed to improving the lives of patients worldwide. And by Mallinckrodt Pharmaceuticals, dedicated to providing safe and effective medications and committed to helping ensure their appropriate use for a healthier world. Additional funding provided by DePuy Synthes Joint Reconstruction and by the University of Michigan Comprehensive Cancer Center.